Hi, my name is Dr. Shiojiri, and I'm going to talk about how we've come up with an online PrEP services in Japan. First, in Japan, although we've had Truvada and Descovy available as treatment of HIV, it's not still approved for use as PrEP. But recently we've had a number of people trying to prevent themselves using PrEP, especially MSM. But this has led to the increase in the number of self-imported PrEP users. And the problem to this self-imported PrEP is that we don't know where they're getting the PrEP from and whether they're taking it properly. And also, there are quite a number of individuals taking PrEP without knowing their HIV status. So we've come up with a sexual health clinic in Tokyo that serves both on-site PrEP medication and also TelePrEP services for those who live outside Tokyo. And so those who come are mostly MSM, transgenders, and commercial sex workers. And the TelePrEP service is provided to all over Japan through online consultation and postal service. What's done on site? When they come to the clinic, we do the consultation and on-the-spot testing for HIV, hepatitis B, and syphilis. And for gonorrhea and chlamydia, we do 3-in-1, meaning genital, throat, anal swab samples put together and sent to the lab. And for online people, we do consultation on phone and also on-the-spot testing. There is an YouTube that we've come up to show them how they're going to do on themselves. We give them the test strips, 3 of them, HIV, syphilis, and hepatitis B, and also a lancet and liquid chaser or buffer to test. And we demonstrate using the finger how they're going to prick and how they're going to put the blood. And how to read the results, we show them the slide, but also they send us the photo so that we can also confirm from our side whether they are truly negative or positive. And as for 3-in-1 kits for gonorrhea and chlamydia, these are the kits that we send them, and they send us back their samples and we put them to the lab. And then the results are sent via a website they check for themselves. So the results that we've had in the past 1 year, we started this service in May last year, and until May this year we've had a total of 673 patients, mostly male, 633 MSMs, and the median age is 36, and female are all commercial sex workers. Median age is 30, a bit younger than the males. And for on-site patients, we've had 80% of them coming, and for online, we've had about 20%. And this graph shows the number of patients who visited for their first time, and they've been increasing of late from around 50 to almost 100 patients per month. So people getting PrEP are increasing here in our clinic. So this is the map of Japan, and you can see the patients coming to the clinic around the eastern region of Japan, where we have Tokyo, Saitama, Chiba, Kanagawa. But outside the eastern region, we've had patients from all over Japan, from Hokkaido down to Okinawa, asking for PrEP online. And as for patients who we were able to retain, are about 63.7%, which is not as high as we had expected. And for those who have come to the clinic are around 57.6%. And compared to that, we've had a high retention rate in the people who are getting the service online, which is 90.7%. And for the prevalence of HIV and STI at the first visit, gonorrhea we've had 3.2%, chlamydia 7.3%, syphilis 0.7%, and for HIV positivity at the first visit, we've had 6 patients, 1.4%, and for those who have started PrEP, we've not had anyone turning positive. So in conclusion, PrEP is getting more attention in Japan, especially among MSMs. And there is still hardship acquiring PrEP for medical services. And as we've seen in the results, there is a high retention rate among the online users. One reason could be due to the limited access and information on PrEP outside Tokyo. And thank you for your attention.